Um, Really delighted to be here. My name is Helena Bodemiller-Evich. I'm the founder and editor-in-chief of Food Fix, which is a newsletter all about food policy. Before I launched Food Fix, I covered all things food, from FDA to USDA, farm bills, and everything in between at Politico for nearly a decade. So I have spent a lot of time covering food safety. I also know Bill Marler very well. I started my journalism career at Food Safety News, which is also something you should all read. Great way to track outbreaks and recalls and all of that. So actually, Bill Marler is the reason I ended up accidentally in journalism, because I had written my thesis about food policy, and he was one of the experts that I interviewed for my thesis. I don't know if you guys know that, but so I go way back with this topic. We have a really great panel here to discuss this film. I'm sure you all have questions about it. We have Sarah Sorcher, Director of Regulatory Affairs for CSPI, who obviously was a star in this film, which was cool to see. It's always cool to see people you know. Are people texting you about this? Yes. Yeah, people are seeing you. It's cool. We also have Brian Ronholm, Director of Food Policy at Consumer Reports, also in the film. Steve, I don't know why they didn't call you, but they should have. We have Steve Ostroff. Yeah, well, they did have Mike Taylor, yeah. So Steve Ostroff, former Deputy Commissioner for Food and Veterinary Medicine at FDA, also former Acting Commissioner of FDA. I don't know how many times, was it twice? I think you were one of the only really food-focused FDA commissioners we've had, even though it was a very brief time. One thing you may not know is that the head of the FDA tends to be much more focused on the drug side, medical issues, and it makes sense when you consider the breadth of the issues that the FDA deals with. But it's nice to see every once in a while a food expert take the reins, even if it's brief. So we have just a few minutes to have a panel discussion, and then we're going to take questions from you. So if you have questions, you should ask them, because it's a great panel. I think the first place we wanted to start is, you are all experts. When you watch this film, what was missing, or what was the context that wasn't presented? Obviously, you can't put everything in the film. I thought we'd start with Sarah. We'll go down the line, but I'm curious what was not in this film.
Yeah,
you wish was.
That's a great question. It's really hard to tell a clear story about food safety, because there's so much that goes into making the food safe, and it's not one set of challenges, it's many, many different challenges. And I think, first of all, the film did a really good job in drawing together a clear narrative and making it clear why it matters, right? How it's not just numbers, it's people's lives that are affected. And then also just showing how it is possible to make progress, and showing how we can actually move the needle on preventing illness. There's just two really important points. I think what they had to leave out in doing that was just a lot of the complicated work that's really still ongoing. Bill had this amazing idea with this petition to treat salmonella like we treated ground beef, and ban 31 strains that are causing outbreaks. And that petition ended up getting denied, but there was another petition that CSPI drafted that Consumer Reports signed, Stop Foodborne Illness, and that's still with the agency, and they've launched this broader framework. And what our petition asked them to do was really look at, how do we develop a process for identifying the worst types of contamination, looking at the strains, looking at the amounts. And they've now moved to ban salmonella in one category of products, and they have a framework they're proposing to make progress on all products. So, also in telling that story, they had to kind of create heroes and villains. And one of the people who didn't come across very well in the film, I think, is Sandra Eskin. But she's actually been behind that effort, which is precedent-setting, groundbreaking, and treats salmonella as an adulterant for the first time. She also, before coming to USDA, really advocated for a farm-to-fork approach to food safety and getting federal oversight on farms. It was just in that position as a USDA official, it's really not the role of the federal agencies to make those decisions. It's up to Congress.
Endorse bills.
Or to endorse bills. Yeah. There's a law preventing them from doing it. And the responsibility is with elected officials, it's with Congress. And so, that's why it's so important to pass bills like the Expanded Food Safety Investigation Act, which DeLauro has introduced, which gets that authority onto farms.
Okay, Brian, same question to you. What was missing?
And just real quick, I just want to acknowledge someone, there's an outdated saying that behind every great man, there's a better woman. So applying that principle, I just want to acknowledge Julie Marler in the audience right here in the front row.
That is true, yeah.
So Bill readily admits that he would be a knucklehead lawyer if it weren't for Julie, so just wanted to... But the thing that stood out to me when I saw this was that there could have been more discussion about the Food Safety Modernization Act. That was a landmark legislation in 2010, 2011 that tried to get to a lot of the principles that outlined in the film about focus on prevention and just kind of setting up a culture at FDA that's focused on prevention. So that was kind of a big piece. But I think the filmmakers, they're trying to strike the right balance. I mean, I think everyone in this room, they could have turned this into an 8-part, limited series, right? And, next episode we're going to focus on Section 204 of FSMA.
That's traceability for all you not doing your acronyms.
Right. So all of us in the room would be watching it, just riveted, but then it would get no mass appeal. So, but yeah, the discussion of FSMA, I think, was really that was an opportunity to maybe kind of talk about how consumers, industry came together to push this landmark law.
Yeah, and then also asking questions about what's working and what's not. Right. Okay, Steve, I'm curious. What was you, other than you were missing from the film? It's a really big oversight.
That I was missing, but I'll say 3 things. One of them is that during my years at FDA, I made it a point to get out in the field a lot, and that was the case with going to lots and lots of different food production facilities. And I will say, there isn't much of a market for, it's not good for your brand to produce bad food and to make people sick. And there's a lot of the food industry that works really, 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 really hard to produce the safest food they can possibly produce. And all I can say is that when you went into one that was really doing it right, you could tell it immediately. And you could also tell the ones that aren't doing it right immediately. And I think one of the things that I wish that we could do as a food safety system is pay a lot more attention to the ones that obviously aren't getting it right. And the ones that are doing a great job, we ought to have a way to be able to reward them in terms of the way that we approach them. So that's number one. Number two is that I think one of the things they didn't get quite right, which I think is a really important issue, is they did very briefly talk about the fact that lettuce goes out of the United States to various parts of the world. But what they didn't bring up is that so much of our food comes from outside of the United States.
Particularly fresh produce.
Fresh produce. 95% of seafood comes from outside the United States, et cetera. And it is so much more difficult to be able to oversee what goes on outside of the country. And all of the examples that you saw here were domestic. And as great the challenges are in terms of what goes on domestically, they're infinitely more difficult in terms of dealing with food that comes from outside of the country. And the third thing that I wish they could have highlighted, one of the things that frustrated me, I worked at the CDC for a lot of years as well, and I always considered myself first and foremost to be an epidemiologist. And the incidence of the major foodborne pathogens hasn't budged in years and years and years and years and years, despite all of these things that we've done. But the one time that it budged was the pandemic. And we saw, not only in the United States, but elsewhere in the world, tremendous declines in the incidence of all of the foodborne pathogens, as well as outbreaks. Now, some of it was that we were diverted in terms of what we were paying attention to, but it seems pretty clear that it's real, and it's telling us something about how people acquire foodborne illness, because everybody wants to blame the consumer in terms of what goes on in the kitchen and says that you're just not doing it well. But the one thing that we didn't do during the pandemic is eat out. We were all eating in. And I remain convinced that what happened during the pandemic is sending us some sort of a very powerful message about how we get foodborne illness that I think needs to be studied.
Okay, that's so interesting. I didn't know that the incidence had gone down during the pandemic.
Everywhere.
Okay, I'm gonna write a newsletter on this now because now I'm fascinated. I was also recently at a meeting with some restaurateurs, and they were saying that a lot of which I found this interesting, I'd never thought about it this way, a lot of the COVID protocols, the sanitizing protocols that were initially in place for, the tables and all of the things that restaurant workers were touching because they were worried about COVID, had some secondary benefits, which were less passing on of other, norovirus and other different things you can pass around in restaurants. And I thought, well, that's a silver lining I hadn't thought about, but I'm putting that on my newsletter list now. So I want to go back to the leafy green issue in particular. For me, as someone who covers these issues, one of the most powerful points one of the most powerful scenes in the movie is when they are doing the aerial footage over the leafy greens, and they're showing the proximity to the CAFOs, which are confined animal feeding operations, for those of you who are not well versed in these acronyms. And essentially they can have hundreds of thousands or tens of thousands of animals in one area, and they're near where we're going leafy greens. Talk a little bit about that issue, and I know you're working on a bill specifically kind of trying to get at this part, but a lot of that is obviously the source. Like, I've been to Yuma, locals know it's the source. It's not a secret that E. coli is coming from cattle, and the cattle are near the lettuce field. So what are you working on specifically to try to work on that? Because it seems like a big hole.
Yeah, so the Expanded Food Safety Investigation Act, which we've talked about a bit already, is just a very simple, common sense bill that gives FDA the power when there's an outbreak of foodborne illness or there's another public health outbreak, and they think it's coming from an animal farm or originated there, to go onto the farm and investigate and take samples and try to identify that root cause of the outbreak. And does
it have a chance?
Yeah. So I think, if we're truly going to have the safest food in the world, we need to have a farm to fork approach to food safety. This is the last place, this is the last set of producers of food in this country that can, if a federal food safety official comes to their door, they can slam the door in their face. Produce growers can't do it. Food manufacturers can't do it. They're feeding us food, and we need to be able to have that assurance that the food is safe. And so for me, it's not a question of whether this bill passes. It's a question of when this authority happens and how. And is it going to happen, is it going to be USDA who gets it? Will it be FDA? How expansive will it be? And importantly, is it going to happen now when we can look forward to preventing the next big outbreak? Or is it going to have to happen on the heels of a crisis when you have Americans sickened and dying and in presidential debates because of the illness that's been caused?
I think I've been in this town long enough that my cynicism tells me the latter, but we'll see. Steve, I want to ask you to weigh in on this because I know at FDA, having repeated outbreaks of E. coli tied to lettuce, it starts to feel familiar, and these issues often do come back to these CAFOs. And without that authority, was it limiting while you were there? I know you.
The answer is yes. I think of it like what's the Willie Sutton rule, which is, why did he rob banks? And the answer is because that's where the money is. Mm-hmm. And the same is, I think, operative here with, potential sources of organisms like E. coli 0157. It's there. We know it's in those animals, even if it's at low levels. One of the things is that, very early in my public health career, first of all, John Kobayashi, who was in the film, was my very first supervisor.
Oh, really? I didn't know
when I worked
that.
at the Washington State Health Department. But my very first outbreak investigation was E. coli 0157, and we thought it was related to ground beef at that time. It was from a fast food restaurant. It preceded Jack in the Box by 5 or 6 years. And Patty Griffin, who many of us know, joined me in that investigation up in Washington State, but we tried to trace the ground beef back to farms, and we went out to various dairy farms in those instances and swab cows. That was in, I think, 1985 or 1986, sometime around then. And we found it. It wasn't that difficult to find in the animals. And so we've known forever that it's there. And when you see 150,000 cattle staring down at you on all of these lettuce fields, to not have the ability to go and try to verify that that was the source of the problem is incredibly frustrating. I mean, it would be like, somebody calling the fire department and saying, well, there's smoke coming into my apartment. And the fire department goes there and says, well, this fire is next door in the apartment next door, but we can't go in there. I mean, that is crazy. And that's the situation that we're faced with. And so I think this would make a tremendous difference in terms of having the authorities to go to where we think the root of the problem is so that we can stop it from happening.
Yeah, and this is where I should insert a little bit of context that it is politically difficult to give additional authority to government agencies, especially when it comes to farms. This is a very kind of sacred American institution when it comes to regulatory issues. I mean, there's a long list of carve outs for farms. This is like part of the American way. So I'll just have to put that note of context.
Well,
although I hear you on it, it honestly will probably be a crisis.
yeah, food is also sacred to Americans, of course. And we did it once, right? With produce farms with FSMA, we have extended authority over farms, so it is not impossible to do. Yeah.
Yes. And FSMA, which was not mentioned in this film, and I agree, was a total oversight because Congress did try to react to the spinach, a really deadly spinach outbreak in 2006, the PCA outbreak, and melamine pet food. And the response was to try to, create a more preventive system. And we are now like 12 years into that process, and there's still some missing pieces of that have not been implemented. And that's one of the places where I think the film gave FDA like a total pass, because it didn't say, oh, Congress passed this law that was supposed to create, ag water standards to make sure that water, there was a couple mentions of water testing and things like that. Those are holes that remain. Those are not policies that are in place. Brian, I want to turn to you because I know you've worked not only on the Hill for Congresswoman DeLauro, former appropriations chair, and also you've been at the highest levels of USDA working on food safety. Why is some of this stuff so politically controversial? I mean, salmonella in particular, I think when you're a consumer and you look at the issue, why is salmonella different than E. coli? Like, why is it hard? I think when you hear about it, it sounds easy, but it's not easy here. Why isn't it easy?
It definitely is not easy. And I think Bill said it best in the documentary when he said, we just lacked the political will to move this forward. The dynamics were much different when Mike Taylor was able to declare E. coli 0157H7 an adulterant.
I mean, it was like on the Today Show, right, and they were having presidential town halls about it, which amazing to watch. Point, we haven't seen anything like that.
At that point, the kind of the internal politics of any administration was a little more decentralized. Mm-hmm. So Mike had kind of more leeway. That
was the Secretary of Agriculture.
Right.
Well, was it Mike Espy, the Secretary?
Espy was the Secretary of Agriculture at the time. Mike Taylor was FSIS administrator. Mm-hmm. And was able to make that declaration. Let's say like Paul Kicker, the current FSIS administrator, and Sandy and Emilio come out tomorrow and say, we're declaring all illness-causing strains of salmonella an adulterant in poultry products, and not, give a heads up to, Bill Sack or the White House. They would be forced to resign the following day, most likely. Just because the administration dynamics, regardless of party, it's more centralized now. It's more focused. They try to control the messaging as much as possible. That's why you saw, Sandy and Frank, they were only given 30 minutes. And they had their talking points that were rehearsed with their comm shops. They were very limited. Meanwhile, I don't know about you, Sarah, I spent like almost 3 hours with them.
Oh, wow.
I they probably cut a lot because I have a face that's not meant to be on a screen. So it's like
Your comm shop didn't give you tight talking points. That's
right.
why.
But I mean, that just kind of gives you a sense that
Yep.
the messaging is so much more controlled now.
Yeah.
The White House is much more attuned on what the agencies are doing in terms of regulations. And just real quickly back to the, into the feedlot situation. I think a baby step was taken recently. Mindy Brashears came out, and Texas Tech came out with a lit review that looked into the feedlot situation and how the source, the potential source of them being produce outbreaks. And this was a study that was funded by Texas Tech and NCBA, and even then they said there needs to be some attention paid to this issue. So for someone like Mindy Brashears in Texas Tech, which obviously she took a beating in this documentary, I like to think that kind of opens the door for further discussions down the line.
Yeah, I remember talking to one researcher who had studied the distance that E. coli 0157H7 could travel from a CAFO. And in fact, I think this was years ago that I wrote about this, but I think they studied it was 300 feet, 600 feet, 1,200 feet or something. And they kept finding it. It met the limit. And I don't know that there's been a ton of research on what is the distance, right? I mean, because it's a really difficult question. You would be talking about upending massive industries. And I think that's why it's been so difficult. But Steve, you look like you wanted to jump in.
Say is that the magnitude of the salmonella problem in poultry is orders of magnitude greater than the E. coli 0157 problem.
In terms of number of people
beef,
get
in
sick.
terms of in terms of number of people get sick, but the proportion of poultry that's contaminated with salmonella is much, 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 much higher than beef ever was with E. coli 0157. And so the bottom line consequences of doing something like this for poultry is much, much higher than it would be for what was done with E. coli 0157.
And that tends to build even stronger industry opposition, which can create problems with Capitol Hill, and then they can block your budget or prevent work. I mean, there's lots of different ways. Although I am curious if this is raising more awareness on Capitol Hill because people are seeing the film. I don't know if there's any staff here who want to weigh on that. We have about 10 minutes to take questions if anyone has a question. If not, I have 25 more questions for this panel. So, but if you have a question, this is a great time to ask it to really some excellent experts. Yes, go ahead. There are no such thing as silly questions.
Why do you have to, why you're going after what I'm calling at a millimeter of what needs to be done? Why say, when we have an outbreak, we're going to try and trace where it came from? Why can't you just test the farms every month? Why isn't the government allowed to test something that could become an outbreak?
Who wants to take that question? I don't know. Did everyone hear okay, so the question was, why are we asking the question, can the government, when there's an outbreak, go test the farm? Why instead isn't the question, why isn't the government testing proactively to prevent outbreaks? And probably you're meaning CAFOs and just any growing field. Yes, good question.
Yeah,
I agree with you.
Yeah, the problem is you're trying to inject logic into Washington, and as we know what's going on above us tonight, I mean, clearly that's not a high priority in Washington. Yeah, I mean, one of the things I heard a lot about from friends, even people I forgot about from elementary school reached out to me.
Are they texting you about?
Yeah, Brian, they didn't realize how fragile our food safety system is. Right? You look at kind of the gaps, and that is the primary gap. Why can't we trace this back to the farms, go there, test the water, test the feeds, see if there's the strain of E. coli that's causing these outbreaks? We can't do something basic like that. I mean, that is a significant hole in our food safety regulatory system.
But the other thing that I'll say is, for instance, if you go back to the Yuma situation, that was a facility that is the largest CAFO, I think, in the country, was that facility in right next to those fields, and it had something like 150,000 animals. And the prevalence of E. coli 157 in cattle is fairly low. But as was pointed out in the film, when you're talking about something like ground beef, where you're mixing together 400, 500, 600, 700 different cows into one lot of ground beef. It only takes one cow to be infected to contaminate all of that ground beef, unfortunately. So when you're talking about that many animals, you have to do a lot of sampling to be able to pick up a low incidence of E. coli 157 in places like that. And in addition to that, the number of animals that move through that facility is just staggering. So, I mean, simply from the statistics, you have to do a lot of sampling. And unfortunately, there are a lot of CAFOs around. Even in Yuma, there were something like a dozen different CAFOs that we were looking at as possible sources in that outbreak. So it would involve a lot of sampling, but I think that we help ourselves if we have data, if we have information. If we're operating in a vacuum, it's difficult to make intelligent decisions.
Yeah, I think it's a common sort of assumption that consumers have that the testing schemes that we use for food safety are there to sort of show whether the product is contaminated or not. And you can't just rely on testing the end product to show whether it's contaminated. We were having repeated outbreaks with papayas coming into the country from Mexico, and the government said, well, let's test everything at the border. We're going to require you to test everything at the border and or show that you've tested it and that it's negative for salmonella. And that wasn't enough, because you can't rely on the negative result to show that it's not contaminated. And I think one of the things they're trying to do with these investigations is identify the root cause for how the product became contaminated in the outbreak, and then use that to inform what practices you're using on the farm. So, the lettuce was being irrigated with water from the canal, but it was only dripping onto the roots, but they were doing aerial sprays of pesticides. Was that how the contamination occurred? Was it wind off the farm? Was it the runoff and the feces into the ditch?
There's birds.
Was it the birds? And so
see a lot of
wild animals. So there's lots of different theories for how it could have happened, and we never really found the root cause in the Yuma investigation. And that makes it hard to plan around how we're going to prevent the next outbreak.
But that was not a silly question. If anyone else has a question, anyone else? Yes.
So I know the answer to this. Are outbreaks the problem? Or is it just continual low-level infection and disease?
That's a good question.
So most foodborne illness is not part of an outbreak. It's, the onesies and twosies that happen, every day, everywhere around the United States. Some of them, if you had the tools, you could, we find far more outbreaks than we used to, because we have much better diagnostic tools, and we can do genome sequencing of the organisms and find out that there's one person in Arkansas and one person in Michigan that turn out to have the exact same organism. But one thing that I do think, in terms of answering the question that was just asked, is that, if you have those organisms from the farms or from the CAFOs, and you do the genome sequencing and you enter all of that into a database, then, the occasional case that also gets fingerprinted that has E. coli 157, it makes it a lot easier to try to figure out where it came from. And so, you can do almost what we refer to as reverse epidemiology, which is you find, the source of the organism before you've been able to link together where all the people got sick from. And so it's a very powerful tool. And that's why I think, I'd rather have more information than less information. But in terms of your question, no, the majority of foodborne illness is not part of an outbreak.
And just to repeat the question so we make sure everyone heard it, it was, are outbreaks the problem, or is there kind of low-level foodborne illness happening all the time? Because most cases are not tied to an outbreak. I just wanted to make sure we clarified that. And then go ahead. What was your follow-up?
No, not to diminish the importance of the outbreak, but
yeah.
if you
Yeah, and I think, the CDC estimates like 128,000 people are hospitalized and 3,000 people die every year and from foodborne illness. And I would guess the majority of those are not actually tied to an outbreak that would make headlines. Some of them would be, but and then that stat from CDC, it would be great to get an update, because as far as we know, other than the pandemic, which I'm going to look into for that newsletter, but we haven't bent the foodborne illness curve in terms of we don't know that anything we've done in the US has reduced foodborne illnesses writ large. We know that E. coli 0157 cases have plummeted because of this very specific and targeted action that worked very, very well. Just to clarify that. Okay, who else has a question? In the back here.
Yes, hi. I think it's important that we talk about not just identifying where it came from, but what we're going to do once we find it. How are we going to prevent that from happening again? How are we going to save people from suffering, or we're calling it an outbreak, and a lot of it stems also from recalls. So we're actually discussing that tomorrow. But I think it's important that people know, because what I'm hearing everybody saying is we need to find the source, but we also need to know why we need to find the source.
Yeah. Just to repeat that so everyone could hear, the question is, or really the point is that we shouldn't just be focused on finding the source, but what it is that you do with that information, finding the source and then preventing that problem from happening again, so that the whole point is that you're supposed to be preventing people from getting sick and preventing these tragedies. And it does feel like in a lot of these cases, or does it feel like it is just a tragedy on repeat? We find the source, or we maybe don't find the source, but it continues to happen. I don't know if anyone wants to weigh in on that, getting to the root cause, and then does that change policy, or does that change FDA's stance on things?
Well, I think that's a really important point, which is that you do all this so that you can develop new mechanisms to be able to prevent people from getting sick. I mean, that's the whole purpose of the enterprise itself. And I've always said, I think every single foodborne illness is preventable. Mm-hmm. And that's the mindset that we ought to have. We shouldn't just accept that this is the way it has to be. It doesn't have to be this way.
I think another thing that this question highlights too is I think the political barriers and hurdles that would have to be overcome to get to your point. You're absolutely right. Yeah, we get to the source. So let's say we get that authority that agencies can go on the farm to identify the source. We have trouble just doing that, just because they shut the door in our faces, like Sarah said, and they don't want anybody, the don't tread on me kind of approach. Okay, so imagine taking that next step. It's okay, we've identified the source of the outbreak. It's in your facility. By the way, here are some steps that you need to take in order to prevent this from happening again. We have to get them to accept that part too. And, that just creates another issue, and it just really kind of demonstrates the hurdles we'll have to overcome.
I think there are these examples we have of moments when we were able to change the underlying standards in a way that caused real change. So banning E. coli from ground beef is one of those. We've seen in Europe, they've been able to bring down salmonella illnesses overall by going back to the farms, ensuring that birds are vaccinated, by banning the worst serotypes from their raw meat and poultry. And we need to change those underlying structures in order to see real change across the population. We can't just, have these repeated examples and everybody feels terrible. Industry feels terrible. Consumers feel terrible. But unless we change those underlying policies, we don't see a real difference.
Yeah, that's a great question. Okay, we're gonna take one more. Yeah, not a silly one, a good one.
When patients come to the hospital for surgery or whatever, and they come out and they get an infection, the doctor is supposed to, it's regulation that the doctor has to report somewhere to the state that this patient has an infection and where the hospital was. So my real question is, when a patient goes to a physician and they think it's salmonella, and the lab concurs it's salmonella, does anybody report that to anybody?
Great question. Okay, so the question is, with hospitals, if you get an infection after surgery, there's a mechanism for reporting that, and it's measured. When someone comes into the hospital or clinic and has salmonella, is it always reported? And what happens next? This is a good epi question.
So the answer is yes. So it used to be in the old days when I started working in public health that it was the responsibility of the healthcare provider to report that information, and they were notoriously terrible at doing that. But now all of the states have moved to a system where the information automatically gets reported from the laboratory that made the positive diagnosis directly to the health department. And so every state in the country has mandated reporting by laboratories of every positive salmonella and every positive E. coli and every positive Campylobacter, and all of them all work their way into the public health reporting system. The problem is that they usually don't have enough people to go and follow up all of these and do the appropriate investigations to try to figure out, if they can identify potential sources.
And the doctors have to order the tests too.
Right.
Yeah.
And these are labs, I'm not talking just in hospitals, I'm just talking.
This is any laboratory.
All labs, yeah. I know one of the barriers tends to be that, some people get pretty sick and don't even go to the hospital. And so there's a lot of cases that aren't even logged that way. And then your doctor has to go, I think it might be salmonella, or I think it might be E. coli or something, and order those tests. So there are a couple barriers to getting there, but once it is confirmed, that is all reported. And we just moved towards also adding Chronobacter, which was the bacteria at the center of the infant formula. I see some people clapping back there. The bacteria at the center of the infant formula.
The other thing to know about it is that all of those laboratories are also required to send the actual salmonella or the actual Campylobacter or the actual E. coli into the public health laboratory so that they can do the genetic sequencing of it.
Great question. So we are out of time. Thank you all for being a wonderful audience. I know it's a little bit late here on the East Coast right now.
Just one last thing, and I'm glad that the film highlighted it, because this issue of everybody continuously saying we have the safest food supply in the world drives me absolutely crazy. And I can't tell you how many times I have told FDA's commissioners who are not from a food background.
That's all of them, just to be clear. Yeah.
They shouldn't say that, because it is really, for somebody who's been the victim of a foodborne illness or had a family member that's had a foodborne illness, it's not safe to them. And so all we're saying is that everybody else's is even worse than ours. And the other thing is that there's a difference between saying we have the safest food safety system in the world and that we have a safe food safety system. It's not the same thing.
Yeah. Well, great point to end on. Thank you all for being a wonderful audience. If you love food policy, you can check out my newsletter, which is called Food Fix. I think you would all enjoy it. But thank you so much for your attention, and I hope you have a great night. Thank you. This is Julie Marler, also star in the film.
Bill Marler is my husband, and we work together, and I just wanted to end on a really... I'm just so grateful that these movie makers took the time to really include the victims in this film, because we hear from them every day when they call our offices and they're in the hospital. They have a child who's really sick and they don't know what to do. And 2 weeks ago, we had a mother who called, and her daughter was ill. And she had been watching this movie, and her daughter had come home from Arkansas University, and she had didn't really know what was going on with her. But in the middle of the movie, she stopped it and took her daughter to the emergency room. And she told the doctors, I want a stool sample, and I want you to not give her antibiotics, because she learned that it could make E. coli worse. Her daughter ended up developing HUS. and her kidneys did start shutting down. But because she didn't get antibiotics and she'd been watching this movie, her daughter was able to recover. I mean, I don't know, who knows what the outcome would have been, but it could have been far worse if she'd gotten the antibiotics. And so, you know, we're just so grateful that it actually helped educate people and parents who are out there, you know, with sick kids. And this girl is recovered, and hopefully she won't have long-term implications, and she'll be able to return to the university. So I just kind of wanted to share a personal story at the very end of it, because it really is about people and, you know, and our health and, you know, protecting the public. So it was sort of one of those, like, if this movie was made and it saved this one girl, long-term implications, it's pretty amazing.